No requirement for ECFMG certification or any of the steps of USMLE. Plus, recommendations like IMG Doctors can now work in pretty much almost any type of practice in the USA with zero prior US experience, even after a clinical gap, are some of the things that have been released by three major organizations. This is the acGME, Accreditation Council of Graduate Medical Education, Intealth, and FSMB, which is the Federation of State Medical Boards. And these three organizations are a big deal in the USA. Here, I'm going to tell you how these three organizations are now providing recommendation based on all the new state regulations that's coming out. So you IMG doctors can make use of this knowledge in order to transition your career into a successful career so you can end up practicing in the USA as a fully licensed doctor. The first thing is about having no ECFMG certification or USMLE. This is for experienced physicians, and this is what we have been referring to as outstanding IMG doctors. Now, here's what they say. They say these pathways for prominent mid-career physicians have long existed in many states, typically do not require ECFMG certification or successful passage of any step of the USMLE, and are likely to continue to be an option for highly qualified and fully trained international physicians. We knew this option. We've been talking about this for a long time, and we know this exists for many years, and this now being on an official document is a big deal. So now you guys understand that if you are an outstanding physician, you can employ this pathway in order to transition to the USA. Now, the other concept we are going to talk about is all the new state legislations that have been employed in many different states, and what these organizations are making some recommendations in order for IMG doctors to successfully transition into the system. Now, the very first recommendation, these three organizations say that any rules that has to be made in terms of bringing these IMGs through the new state regulations has to be done by the state medical boards. In other words, these state medical boards are responsible for implementing the additional licensing pathways that would be required for these international medical graduate doctors. Now, this could vary from state to state depending on whatever the state medical board decides that is going to benefit for those states. So basically, they are saying you state medical boards come up with all the rules that you think is appropriate for your state. The second recommendation is that these organizations are saying the IMG doctor must have an offer of employment. In other words, you should find a job that is appropriate for your experience in any particular state, and then the hospital has to say they are actually willing to hire you. And only then you would move on in starting the process of applying through these specific state pathways. Now, these organizations also say these states can not only take international medical graduate doctors in acGME accredited programs, now this is new, but also in a federally qualified health center, a rural health clinic, or any other licensed clinical facility. Now, this category means there are a lot of places which now can potentially take IMG doctors in order to work in the USA. Now, the folks who cannot do this are those people who have a solo practice, meaning it's a practice that has only one doctor, or it is a very small group practice, because now these organizations think these folks would not have the ability to manage and supervise these candidates, now which I completely agree with. In fact, I'm even surprised that they have expanded into so many different categories, which actually is going to work in your favor as IMG doctors. If you are a department chief or a hospital leadership listening to this, you don't have a choice. These things are going to happen very soon, whether you like it or not. In order to take benefits of this and to hire outstanding international medical graduates in your department or in your hospital, you can always reach out to us at www.imgsecrets.com, and we can help the hospitals hire these international candidates. And we have a lot of people who come to us and speak to us. All right, moving on to recommendation number 3. Now, this recommendation says that your medical school or medical college must be recognized by World Health Organization, a fairly basic requirement. And these three organizations, which is the acGME, FSMB and the Intealth, also say that these candidates must finish their USMLE steps and be ECFMG certified in order to transition through these state-specific pathway.
What are you talking about?
Did that sound very confusing to you? Because I started the video by saying you do not need ECFMG exams. Well, let me clarify this. What I said in the beginning is also true. this is also true. What is the difference? ECFMG is required, is based on the state-specific pathways, okay? But the fact that one does not need an ECFMG certification is based on the IMG being an outstanding IMG and is hired through individual hospitals, irrespective of what the state regulation is. I do want you guys to differentiate these two, okay? One of them requires ECFMG and the other one does not require ECFMG. If this is all sounds confusing to you, not a problem. I completely understand these are very difficult concepts. You can always reach out to us on our website imgsecrets.com and we will be more than happy to guide you what exactly you should be doing with your career and what are the steps you need to take so you become successful. And we can even tell you if you're someone who would need ECFMG, someone who do not need ECFMG and things like that. Fantastic. Now here is recommendation number 4. You must have completed your postgraduate or residency training in your home country. I completely support this. Now here's the thing. You would have completed your medical school or medical college from your home country, and then you would have completed your PG training from your home country. We have to be extremely qualified because we must provide high quality safe care to our patients, and that's like the most important thing for us as doctors, okay? Here is where it gets a little non-specific. They say that this PG or residency training from your home country should be substantially comparable to that of the training in the US. Now, they do not comment on what this exactly means when they say substantially comparable, but rather they're putting the onus on the state medical boards to define what exactly substantially comparable means. Alright, now here's where it gets a little confusing even to me. Now they say that formal postgraduate training and accreditation is not available in all countries and jurisdictions, okay? In its absence, some states and territories may be inclined to consider alternative forms of training abroad. So I'm a little not clear what exactly they're meaning by that, because ultimately, to me, I think some form of training would be required if you're dealing with patients. To me, every patient, no matter what part of the world they are in, are special, and they must get the best quality care. That's the way I think about it. And irrespective of what country you're in, I feel like the training should be fantastic. So ultimately, any doctor for that matter gets experienced enough to take care of patients in a safe way. Well, they also touch upon things like what happens if you're accredited by acGME International and other things. So as it stands, this document can be confusing at times. If I understand this correctly, you must have completed your PG training or you must have requisite experience in a particular field, and if you have completed your USMLE step 3, then they would even consider you even without your home country PG. Now all this is fine, but I would have a hard time understanding what hospital would be willing to hire a candidate like this. If they do, good for you, and do let us know in the comments below. Recommendation number 5 is, once you have finished your postgraduate training in your home country, you must have a valid license in your home country saying that you're now allowed to practice that specialty over there. Now this can be any specialty, and your license should be in good standing, meaning you should not have any problems with your license, you should not have any problems with your professional conduct, and they also say a 3 years of experience is required. What I'm not clear is, does that 3 years of experience come with the residency training, or are they saying this 3 years has to be over and above your residency training? So that part is not clear. Let's wait and see what happens with this. Now, recommendation 6 is a big deal. They're talking about out of time in clinical practice. Now, what happens if you're unable to practice for an extended period of time? Now, this could be because, let's say you got sick, you have a baby, you have a problem in the family, or you're immigrating to the US and you're on a dependent visa and you're unable to do anything. Now they do have some good news for you guys, which means you can actually, if I understand this right, this means become eligible to apply for the additional licensure pathway if your time out of practice, I think, is 2 years, because we conventionally talk about not having a gap of more than 3 months, and if they are specifying 2 years, that's a big deal. Now, again, I would be interested to see if any of the hospitals would be willing to hire an international medical graduate doctor through this pathway with a 2 years of clinical gap in their practice. Again, I understand if there is a legit reason that these folks should be given consideration, but however, I think the onus still goes to the hospital and the state medical board eventually to decide how they can handle these candidates. Many of them could have come with their spouse to the US and are on dependent visas and are unable to work. So looks like there is some hope for these guys. Let's wait and see. Now here is a recommendation number 7. It requires that the states bring in these international medical graduates through a provincial license. Now during the period of this provincial license, which could vary anywhere between 1 year or maybe 3 years, or it could be a varied duration. I think the average is 2 years. But basically these IMG doctors must be supervised by a fully licensed physician or surgeon in the US, and it should be obviously in the applicant's same specialty. If you're a radiologist, obviously you'll be supervised by a radiologist, not by someone else. And during this period, the candidate would undergo some sort of assessment. Now, and also they require that the employer, which is a hospital, provide adequate support, because these IMG doctors are coming from outside. They need time to get used to the US system, the culture, and also understand the electronic health record if you come from a country that does not have this, the billing information, coding information, insurance information, and all those. So they require the hospital provides support with all this, so the IMG doctor ends up to be successful. This is great. Now here is our next recommendation. So basically what they say is, if the state medical board have created these new pathways to hire IMG doctors, they should also have a pathway through which these IMG doctors can transition from having a provisional license to a full unrestricted state license. Now, it's up to the states to decide if these candidates must complete their USMLE Step 3, must complete any additional assessments, or do anything else. So they have left up to the states to decide what they want to do. By states, I mean the state medical boards. And also, during the period of provisional license, the applicant must have good evaluations and must demonstrate he or she would be an outstanding IMG and do the things that they are assigned to do. And I would say even go over and beyond. Now, those will carry a lot of weightage for you all. For the recommendation number 9, the 3 organizations recommend to the state medical boards that they should have an ongoing way of evaluating these candidates to see whether this pathway has been successful or not. So basically, they're going to collect some information like how many number of applicants each state has, the number of individuals who receive a provisional licensure under this pathway, and how many get rejected as well. So they want to see both the positive and the negative outcomes here, and how many of these folks with provisional license go on to receive a full and unrestricted license, and how many people stay in practice in their specialty of training in rural and underserved areas. Obviously, everybody is going to practice their specialty, but how many are focused on going to rural and underserved areas is what they're focusing on, because ultimately one of the things why the states are doing all this is to bridge the gap between the physician gap and the number of patients in rural underserved areas. So they want to see it's actually working over there. All right. Obviously, from the global IMG community standpoint, you all have to make sure you all end up getting a full unrestricted license, because this means these programs have been successful and the states are more likely to continue them. So if you get a position like this, please don't screw it up, but rather do a good job and then ensure that you bring a good name not only to yourself but also to the hospital and the community. Now, there might be also a category of people who come to the US, get these license and become a fully licensed doctor, and they may then decide to go back to their home country. Now, the state also wants to follow this up. I'm not entirely sure how they can track this information, but I guess this is one of the metrics that they would look at. And interestingly, they also want to see how many individuals finally achieve board certification. And these organizations would most likely create pathways for people to be board certified as well, because if they're discussing all this, I mean, this is a big deal. And they also want to ensure these folks become board certified. And also they want to track all the costs that's going to take for them to do all these additional licensing pathways and things like that. Now, if you're watching this video even now, I want to tell you this bonus tip as to how to approach your situation. So basically, think about this. If you have finished your medical school or college from a World Health Organization recognized place, if you have completed your PG training in your home country, you have a license to practice in your home country, then you can explore these new state pathways. Essentially, you have to find a hospital based on your background, based on your experience, that is willing to provide you a job. And this job, if you get in, will help you transition into the US, will help you get a license, a provisional license, and will also help you get a visa through which you can continue working under supervision. Now, following the number of years of supervision, you get a full and unrestricted license. Following this, there would be options for you to be board certified, which if you're not sure, you can always speak to us by appointments through imgsecrets.com. On the other hand, if you're someone who has been working in your specialty for quite some years and you have done a lot of other work other than clinical work, if you think you have accomplished quite a few things in your specialty, then you can transition to the US even without USMLE or ECFMG that I said in the beginning of this video. And that's an entirely different path than the state legislative path is. Again, if this all sounds confusing, we are here at imgsecrets.com for you to speak to us by booking an appointment. We'll help you with all this. So bottom line is, wherever you are in your career, your focus should be finding that position in a hospital in the US. You would do this by preparing a fantastic CV, a cover letter, and really focusing on where it is more likely for you to get a job, and then apply there and see what happens. Alright, now that you know about all these new things, I'm going to recommend you watch this video where I've talked exclusively about the alternate entry path through which you can transition into the US even without USMLE, and then you can become part of the US system. Any questions, do post in the comments below. Take care, stay safe, I'll talk to you soon.